Good morning. Thank you, everyone, for being here. I'm Sheila Anderson. I'm the president and CEO of Prevent Child Abuse California. And I'm delighted to be here with very many esteemed speakers and supporters of a piece of legislation that our organization has sponsored. We are dedicated to preventing child abuse and neglect. And in particular, what we want to talk about today is shaken baby syndrome. Shaken baby syndrome doesn't have to happen. It's 100% preventable. And the fact is, we know how to prevent it because other states and other communities have tested a model that's been proven effective each time it's been replicated, everywhere it's been replicated. And this bill, sponsored by Senator Padilla and some of the other legislators and supporters, would set up a program here in California to replicate that program. About 150 children are victims of shaken baby syndrome in our state each year, and that may sound like a small number to you. But what I want you to know is that the latest research says that for each one of those we know about, there is probably about another 150 other children that aren't diagnosed or aren't diagnosed until much later in their lives. And the cost of that to all of us, in addition to the human suffering, is staggering. At least $600,000 per year on average for children to survive, and a third of them don't survive. So we think this is an important piece of legislation. We think that because we do know how to prevent shaken baby syndrome, we are in fact obligated to do something about it. So first I'd like to introduce to you Senator Alex Padilla, who is the author of the bill SB 825.
Well, thank you very much, Sheila. I want to thank everybody for being here this morning for this very important conference to bring attention to the legislation. It's great to see the groups and the families that are here supporting the measure and that help us spread the word to never shake a baby. As Sheila mentioned, experts estimate that 150 infants and young children are victims of shaken baby syndrome in California each year. And nearly a third of the children diagnosed with shaken baby syndrome die. Nearly a third die. Of the surviving children, 60 to 75% go on to live a life with significant disabilities, which could include both mild and severe retardation, paralysis, cerebral palsy, seizure disorders, blindness, and other conditions. California can and should do more to reduce the number of cases of shaken baby syndrome. Now, educating new parents is a proven and effective way to reduce the tragic number of innocent victims. Educating parents does save lives. Senate Bill 825 would establish a public education program in hospitals throughout the state of California, patterned after the very successful program in the state of New York. In New York, public education programs have reduced the number of shaken baby incidents by half. If they can save lives in New York, we can and we should save lives here in California. Now, I know full well, my colleagues here know full well, that the state of California is facing a significant budget crisis, and many people would ask, how can we afford to take on yet an additional program right now? I suggest that we can't afford not to take on this program right now. First of all, the bill itself would be paid for with money from the State Children's Trust Fund, a special fund, so it would have no impact to the state's general fund. But now to the direct costs of shaken baby syndrome. The cost of care can be as much as $3 million in the first 5 years of a baby's life. For every incident we can prevent, we can save at least $3 million. If we reduce the rate by half, we save half of the ongoing health care costs. But I also want to remind us all that this legislation isn't just about saving dollars and cents. This legislation is about saving lives and saving the hopes and dreams of children and their families. This legislation has enjoyed bipartisan support throughout the Senate and the Assembly, and is supported by the Department of Social Services and the Department of Public Health. And in closing, just want to thank the Sheila Anderson and Prevent Child Abuse California for their ongoing support and their work in helping get the bill to this point. And maybe if I can introduce some of my colleagues to also speak to demonstrate some bipartisan support, both Senator Elaine Alquist, who chairs the Budget Subcommittee on Health and Human Services, and Sacramento's very own Senator Cox for a few words.
I'm very pleased as a yaya, a Greek grandmother, and one who's been a parent for 38 years, to be a principal co-author of Senator Padilla's bill. This is my Chief of Staff, Silaja's beautiful daughter. This is Ella. Ella, can I hold you for 30 seconds? You let me at the birthday party. No? No, okay. She loves her mommy. What I really would like to say, and I'll be very brief, is that no baby should ever be shaken. Now, when I became a parent 38 years ago, people didn't tell us this. We did not have this kind of information, but we do today. And Senator Padilla has a wonderful bill that will help educate parents, help them to understand what really must not be done. 150 children a year does not seem like very many to some people. One child a year would seem like the world to me of what should not occur. So I really hope that Governor Arnold Schwarzenegger will sign this bill. It's extremely important, and I'm pleased to be a part of it, and I'd like to thank all of you who have helped us get this far. Thank you.
Good morning. You know, I am a father of 3 daughters, 6 grandchildren, and from my vantage point, it's just simply unconscionable to think that an innocent child can be harmed. I won't spend any time this morning going through the numbers with you because those have been done, but the important consideration this morning is to know that, in fact, shaken baby syndrome, it's preventable. Doesn't cost us any money to do that, and even if it costs us money, we ought to be, in fact, working as diligently as possible to eliminate even one shaken baby case. And certainly informing parents and caregivers of the life-threatening effects like brain damage or death caused by the shaking of a small child can, in fact, we can reduce those tragedies. It is my pleasure to co-author this measure with Senator Padilla. Senator Padilla and I don't always agree on a significant number of issues, but we do agree on this. Thank you, Senator Padilla.
Thank you. I'd like to introduce to you now Dr. Angela Rosas. She's the Medical Director for Child Abuse and Neglect at Sutter Sacramento Medical Center.
Good morning. I'm happy to be here this morning. I'm the pediatrician who started the Shaken Baby Project here in Sacramento, which is now spread out through many counties in Northern California. When we started the project, it's actually a very simple model in that we essentially teach parents how to deal with babies who are crying. Crying is a normal response that babies have, and what we do is you teach them how infant crying really is what happens to babies before they're shaken, and teach them what to do when an infant cries. Things that you can do with essentially just swaddling a baby, carrying a baby, holding the baby gently, maybe giving them a bath, just walking with a baby. If they get so frustrated, they can actually call a friend. We even give them hotline numbers if they don't have anyone else to call. And these simple things you can do with a baby when an infant starts crying are the simple tips we give to all parents before they go home with a newborn baby. We tell them this in a videotape before they go home from the hospital. We give them a tip card with 10 things you can do with a baby before they go home from the hospital, and they take that tip card and they have that handy when they're going home with the baby, and they can use that in the first few months when the baby is going to cry, because all babies cry. And that simple step, along with signing a pledge card where they promise never to shake their baby, and probably most importantly, they promise to tell this message to anyone else that takes care of their baby, whether that's the boyfriend that may sometimes be with the mother, whether it's a child care provider, or anyone else that may be taking care of that baby. And those 3 simple steps is the education message that we give to these families. And that message, which has been shown in New York, multiple other states, and even our own community here in Sacramento, has reduced rates of shaken baby syndrome. In New York, it showed reducing the rates by 50%. In our program here in Sacramento, which we started back in 2005, has now reduced our homicides from 8 to 1, just in our program here in the first few years of the process. And we continue, though, to use the program. Unfortunately, because we had just a few short years of funding from our project, when our project money ran out, our rates of shaken baby syndrome started to go back up. So what happens with programs when you don't have enough money to keep on running the program is that you lose some funding. So it's very important for us to develop sustainability within this project, not just in our community, but within a region and statewide. So it's very important to develop a system to sustain the project statewide with state legislature, to be able to develop a standardized program that is very effective. We've shown that it works here in California in our Sacramento County program, and we really need to develop a way to perpetuate the program statewide with state legislature.
Good job.
And now I'd like to introduce Maria Alvarez. She is the grandmother of this handsome young man who's sitting here to my left, Adam. And Adam was shaken as a baby, and Maria would like to tell you a little bit about that experience.
Hi. Like she said, I'm Maria and Adam's grandmother. This is Adam. Before the incident, this is 6 months old. He was sitting a year when the day after his birthday, which we celebrate on July 7th, he was fighting for his life. They briefly told us that he had fallen. He had a brain injury so severe that they were not expecting him to make it. They actually gave him a 5% chance of survival. He had retinal hemorrhaging, and again, we thought he had fallen. A couple of days later, we found out that it was a non-accidental injury, which we were like, what does that mean? He was not in an accident, he just fell. That's when they told us that he was shaken very violently with a lot of force and thrown against the wall. I just thought it was a nightmare.